Hello, everyone. My name is Callie Rumfelt. Hope you all are doing well today. This presentation will cover genitourinary syndrome of menopause and the care of the elderly patient. Here are our learning objectives for today. Just have an overview of GSM, its symptoms and diagnosis, some treatments, and then some considerations in caring for the elderly patient. So, genitourinary syndrome of menopause is the new term used to describe the result of decline in serum estrogen levels in menopause. You may have previously heard it referred to as atrophic vaginitis or vulvovaginal atrophy. Um, Estrogen maintains the health of the vagina, the vulva, urethra, and the bladder floor. So, GSM causes changes to these structures, and it leads to many symptoms that affect the health and daily lives of postmenopausal patients. Over half of menopausal patients are going to experience one or more signs and symptoms associated with GSM. And this most commonly includes, but it's not limited to, vaginal dryness, burning, and irritation. You can have sexual symptoms of vaginal dryness, such as discomfort or pain during sex. And urinary symptoms include urgency, incontinence, particularly stress and urge incontinence, and recurrent urinary tract infections. GSM is diagnosed largely clinically, and it includes a thorough history and physical assessment. Lab tests are not usually necessary for the diagnosis of GSM, but they may be needed to exclude other causes of presenting symptoms, such as infectious causes like STIs or UTIs, cancers, or pelvic causes of dyspareunia. If you're working in primary care, continue to recommend gynecological care for these patients. Older patients may feel like they no longer need to see gynecology if they're not in their childbearing years, but we still recommend an annual examination. The average age of menopause is around 50 years old in the United States. This is important to note because patients are going to spend about 40% of their lives post menopause. Studies tell us that 70% of those patients with these symptoms are not going to seek help from their provider. So they might be embarrassed or they may think their symptoms are just a normal part of aging. So, as a provider, you may need to start this conversation, ask patients about their symptoms, and build a good working relationship to make you and the patient more comfortable talking about these issues. Physical exam is an important part of treatment, and I've listed here some findings that may indicate vaginal atrophy. Just a note, it's very important to exercise caution when performing speculum and bimanual examinations in patients with severe atrophy or narrowing because it can cause pain, bleeding, and even injury. You may find that you need to use a smaller speculum if the vaginal opening is extremely stenotic, and just don't cause the patient undue stress if you're not able to insert it. Talk about some treatments. So there are several types of treatment for GSM. There are some non-pharmacologic and non-hormonal options. Lubricants are most often used to make sexual intercourse more comfortable. Pharmacological therapies involve replacing estrogen to relieve symptoms. Systemic estrogens are usually considered in patients who have other symptoms of menopause, such as hot flash. But I've listed here some other therapies that can be used for patients that aren't comfortable using hormones. However, estrogen therapy is the most effective treatment for GSM. Because of the loss of natural estrogen, it's a chronic disease, and other therapies are not going to slow its progression. So, those lubricants, moisturizers, those aren't going to make the symptoms go away forever, and it is eventually going to progress. Low dose local or vaginal estrogens in multiple forms are usually the preferred first line treatment. They have very little systemic absorption and are generally considered safe, but you may need to collaborate with a patient's oncologist if they have certain types of estrogen sensitive cancers. And as always, consider patient preferences when prescribing and treating. Some other considerations to have, let's go over some things when caring for geriatric patients. So consider the impact that GSM symptoms can have on daily life, relationships, sexual intimacy, or autonomy. We already talked about the fact that these patients are going to spend 40% of their lives with these symptoms. So always keep in mind that this is affecting relationships. It might affect their ability to get to the bathroom or just general discomfort in daily life. Some patients may see the FDA black box warning on estrogen and they might not take it, they may not understand. So make sure you're educating all patients on the safety and efficacy of local estrogen and the risk of systemic estrogens, just so you can ensure equitable care. Collaboration with other providers has been shown to improve outcomes, and you can always involve physical therapy, psychiatry, things like that for patients that aren't interested in hormonal therapies. It's an obvious choice, but also you can refer to gynecology. You may encounter certain barriers to care when treating patients with GSM. So, vaginal suppositories or applicators might be really difficult for older patients to use themselves. So, consider if they have a support system, if they are dexterous enough to use those smaller therapies. The high cost of specific estrogen therapies can lead to the use of or the prescription of less effective therapies, which can lead to the worsening of atrophy and other symptoms. So, consider that. And then NPs are in a unique position to bridge gaps in care and treat postmenopausal patients. So we can't treat what we don't know about. So it's always good to build rapport and ask patients about their symptoms. And then be aware of your own biases. For example, sexual health is still a really important aspect of health for the older adult. So don't skip certain topics due to the patient's age. Here are the references that I used. And thank you so much. I hope you learned something today and can better care for the patients that you encounter with the genitourinary syndrome of menopause.